Hi everyone, and welcome to another episode of qrsTV. Today I'm going to talk to you about an ECG in a 10-year-old male-neutered Cocker Spaniel. So we have a 9-lead ECG in front of us, and again I'm going to focus on the lead 2 rhythm strip on the bottom. Remember our questions, the series of 8 questions that we're going to ask as we go through this in sequence, starting with heart rate. So if I use the 300 rule, I've identified sort of my longest interval here and my shortest interval, and I'm getting a heart rate anywhere from 100 beats per minute all the way up to 300 beats per minute. So it is quite variable, which leads me to the next question, which is my rhythm regular or irregular? Clearly it's irregular. And specifically what I would say here is there are regular periods with specifically early beats occurring. And so we can see sections, again, that are very regular with intermittent early beats happening. Is there a P wave for every QRS complex? My answer to that is no, but with a question mark. So let's dive into that a little bit deeper. Here I'm identifying 2 collections of beats where I'm quite assured that there are P waves here. Specifically, the beats on the right, I can see nice examples of P waves in front of those QRS complexes. And on the left, I still think they're there. They're a little bit smaller, but I'm convinced they're there. Whereas when I look at other sequences of beats, like the ones I have circled here, I'm questioning where are the P waves for those particular beats. And here I'm focusing on those early beats. The P waves are much more difficult to identify. And again, these 2 singular, more early beats that I've circled, where are the P waves for those? I'm going to come back to that, but that's why I'm questioning, are there P waves here? Yes or no? How about, is there a QRS for every P wave? Yes, I think there is. So every P wave that I do see does have a corresponding QRS complex. Next question, are the P waves all the same? No, not exactly. So coming back to that P wave issue again, here I'm convinced I have nice P waves in front of my QRS complexes, even though they're kind of slightly different from each other in these 2 collections of beats. Still positive though, just maybe slightly smaller in the collection of beats on the right compared to the left, but within reason, recognizing there is a little bit of baseline artifact here. Whereas when I look at the singular early beats that I pointed out, the P waves here, if they're there, I think might be quite different. So here I've pointed out with the arrows that on the heels of the T wave of the preceding beat, I think there might actually be a little extra deflection there, a little extra negative deflection that could represent the P wave for these early beats. And if that's the case, then these P waves actually look quite different than the positive P waves on the other beats. And yet again, for this collection of early beats here in the center, I don't see obvious P waves with these, but I'm also thinking it's quite possible that they're buried in the T waves of the preceding beats. So that's why I've put arrowheads here on the T waves. The T waves might be a little deeper or have a more negative peak in there. It's possible that there's buried P waves, but I can't be for sure. Suffice it to say though, I'm quite convinced on the basis of the previous beats that I showed you that some beats have nice normal positive P waves, and some of these early beats might have different looking and specifically negative P waves. So the P waves are not all the same. Are the QRS complexes all the same? Yes, I think they are within reason. Is the PR interval constant? Yes, within reason. And are the P waves positive in lead 2? Well, we already said no, not all of them. So what ultimately is my rhythm diagnosis here then? Well, I think I have some sections that clearly meet our criteria for sinus rhythm. So I'm comfortable calling some of this normal sinus rhythm, but I need to say normal sinus rhythm with what? Well, now we need to focus on those premature beats. We have early beats with different looking P waves. So then what kind of early beats are they? Well, if I'm convinced that they have associated different looking P waves, I'm going to infer they're coming from the atria, and I'm going to call them atrial premature complexes. So ultimately my rhythm diagnosis becomes normal sinus rhythm with atrial premature complexes. Hope that helped, and we'll see you next time. Bye-bye.